Namaste, everyone. My name is Dr. Chavi, and I'm a trained psychiatrist. And I have been having this on my mind for a really long time to make these videos, primarily because of my own journey in life. I've always had a bit of an autistic and ADHD angle to view things and to have perspectives. Having said that, despite being a trained psychiatrist, I was somewhat blissfully unaware of the fact that I was myself autistic and I myself had ADHD. And I'm going to delve into those aspects of my own life in my future videos. But for this particular video, suffice it is to say that I've always had this passion bubbling up inside of me to make these videos because I personally feel that because of my autistic and ADHD angle, I've always had a way of viewing things and developing perspectives which often didn't quite match with the conventional mainstream models around mental health. And so, suffice it is to say that I do feel convinced in my long drawn career as a psychiatrist that my insights, however, at obtuse angle or seemingly different they might be, have helped my clients in developing insights into their own lives. So, with that hope, I aim to pursue this passion of mine in developing insights in the society about some of my own understandings in my career as a psychiatrist about mental health. So, in this particular video, I wanted to talk about how, um, when we do not know about the basic bedrock of where our mental health is stemming from, we can end up living a life which is confusing, baffling, and just quite distressing. And often in my career as a psychiatrist, I have seen that when that aspect of the bedrock of your mental health is in fact not explored by your psychiatrist or mental health professional, it can end up being a tedious exercise, sometimes spanning over decades, where you aren't quite putting your finger on where exactly the issues are stemming from. And that is just life altering, to say the least, in that if only somebody had sat down with you to discover that bedrock of your mental health, essentially you would not keep on getting misdiagnosed for years, and you would not keep on going to seek help but come back thinking that you've gotten help, but actually it is of no help per se in altering your mental health. So I'd like to talk today about the bedrocks, in the sense that two of the important conditions which often get missed by mental health professionals, by psychiatrists, in being picked up in an individual, which are essentially leading to all sorts of mental health issues, happen to be autism and ADHD. And since I have personal lived experience with both of these two and I've been formally diagnosed, I've wanted to share some of my own insights based on my personal experience and also my insights based on the experience of a lot of my clients. So I'm reminded of a 20 something girl who, obviously, for the reasons of professionalism, I am not going to divulge details about. The interesting bit is that this is just a hypothetical example because I've seen many such clients with similar age profiles, gender profiles, and similar presentations. So, this 20 something girl would have a lot of mood fluctuations. She was doing well in her life, in that should always been a high performer academically, but also would struggle to hold down on her performance, in that she had a very sporadic fluctuating kind of performance, in that there were semesters and years when she would just be on the top of the class, and then there'll be few days where she would struggle to even submit her basic assignments in time. And she would have constant mood fluctuations. Because of these fluctuations, she would often find herself in despair and sadness for weeks and weeks, which sometimes she couldn't even explain as to why she was suffering from those. And on other occasions, she would often struggle with frustration and anger and disgruntlement. At times, she would have reasons that she could attribute the same to, but often she would have no reason to attribute these emotions to. Often she would be high on her self esteem, but on many other occasions, she would find herself chastising herself, criticizing herself that she's not good enough, she's not even performing the basic things. Now, on the face of it, of course, she was seen by two psychiatrists, and so on the face of it, it seems like a very classical presentation of emotionally unstable personality, in that she's having constant mood fluctuations, inexplicable mood fluctuations, constant fluctuations in her evaluation of herself, constant fluctuations in her self esteem, as also fluctuations in how she viewed the world and how she viewed people around her. There were occasions where she felt that she's getting on fine, she would almost idolize them, and on other occasions, she felt that the world was not worth living for, and people were always disenchanting, and it was not worth going in uh, to with an expectation to form bonds with the people in the world. Now, sadly, when you examine it from a very superficial scope, sadly, most psychiatrists are likely to commit an error of diagnosing this as emotionally unstable personality, especially because it's a woman. It's a woman in her early 20s, and she's demonstrating some of the classical signs which have been described in Diagnostic and Statistical Manual and the International Classification of Diseases. Having said that, what we need to understand that personality is something that is an outcome of our brain, our temperament, our environment, our experiences, our interaction with the world. So personality is not something that is written in stone. It's not something that is rigid. It's not something that is exclusively determined by genetics. So yes, on the face of it, this person seems to have personality traits which are showing a lot of fluctuation in her mood states, in her concepts of self and concepts of the world, and is also and what I forgot to mention was she is also demonstrating some tendencies of self-harming, something that I'm going to talk about in detail in my future videos. So yes, on the face of it, she seems like she's suffering from emotionally unstable personality, the treatment of which happens to be therapy, which is referred to as dialectical behavior therapy, and sadly medications are of no use. Whilst she when you read about the diagnosis of emotionally unstable personality, it resonated very well with her. It kind of makes sense have the personality disorder. However, she was obviously disgruntled about the fact that it was a case of a long drawn therapy, that there could be some hope with this sort of a diagnosis. And she wondered the inquisitive spirit that she had as to why it was the case that on days she felt mostly fine, and in fact was doing very well with respect to relationships. On days she was the life of the party, on the other days she was actually feeling like she just didn't want to interact with the world at all, and she wanted to stay indoors. So I have described enough. On the face of it, a large part of non discerning professionals may diagnose this to be either emotionally unstable personality, or sometimes what we refer to as soft bipolarity. And soft bipolarity is wherein there is no hardcore evidence of mania and depression, but people seem to have a lot of fluctuations in their mood states. Now, I tried to delve deeper into her history right from when she was a child, and that is one of the very important things, that if you visit a mental health professional, it's imperative that childhood history is delved into, because there is a lot that's hidden in our childhood histories. And it is a cardinal sin to ignore the childhood history and the development history, because there's so much evidence that lies in that part of our life which tells us the kind of brains that we are carrying. So when we delved in there, we found history in that she was a very hyperactive child. In that she would not sit about; she was constantly trotting about, exploring things, touching things. Even when they would go to their friend's place or relative's place, she was not a child who would easily sit quietly in one corner. She would be exploring the drawers and the almirahs of the people that they were visiting, much to the dismay and embarrassment of parents, because on one hand this was a very curious exploratory child, but on the other hand this was a disturbing interfering kind of a child, and who wouldn't really stick to the social norms of not exploring about enough, not exploring about a lot when you're visiting a relative. And she wouldn't really keep much to herself. She would talk to the strangers. She's always very social, very jovial. She'd easily make friends, and would break things often, would open up things often, would spoil things often. So, on the plus side, she was a very curious, bright, social, affable, friendly, seeking social contacts kind of a child, but on the other hand, she seemed a bit disruptive, destructive, impulsive, and difficult to manage and difficult to quieten down kind of a child. We have to understand that the very thing which gives rise to a positive attribute in our temperament as a child or in our personality as an adult also gives rise to a seemingly negative attribute. You see, the positivity and negativity of a particular attribute is determined by the kind of environment we are supposed to thrive in. I always like to give the example that if you have to be a sports person, a swimmer, and if you're naturally inclined to be far more hyperactive, agile, and just too physical, then obviously it's going to favor you in sports. But equally, that kind of attribute is not going to be a very helpful pattern for a child, for a classroom learning paradigm. Because in the classroom learning paradigm, you have to sit yourself down, you have to sit quiet, you have to absorb information, and you can't be fidgeting about a lot. So we have to always bear in mind that anything that comes as a positive attribute almost always has an underlying ugly belly to it. And I don't mean to label it as positive or negative, but what I'm trying to emphasize is that it is the environment that we are supposed to thrive and work in which determines the positivity and negativity of a certain attribute. So when we looked at this girl's history, it seemed like that she's probably always carrying the attributes of what we call as an attention deficit hyperactive child, in that she was always um, hyperactive in physicality and also very hyperactive in her mind, and that she was always able to swiftly change focus. Now, understand this too, that when we say somebody is able to swiftly change focus, this is a very good attribute if you're required to multitask, if you're required to be creative, if you're required to interact with teams, if you are a child who needs to have a lot of children to play with. That's a lovely attribute, but equally it's not a great attribute if as an individual you're likely to be in a role where you have to hyper focus or focus on a certain task for certain hours at a stretch, which is why often ADHD children may have brilliant um minds. They may be very intelligent, but that may not translate into a very good academic performance, largely because uh, academic performance in the current paradigms wherever we are in the world largely depends on the ability to focus for long hours, to sit for long hours, and perform in exams which are also conducted over long hours. So whilst they will be very bright, they may not have that much academic excellence to uh, to prove for themselves, and this disparity would often be very confusing for you. That my child or I am so bright and intelligent, scoring high on IQ tests, and seemingly everybody gives this feedback that I'm great, but seemingly I'm not being able to translate the same into academic performance either. So that disparity is understandable, because what we require to perform in academic tests is very different from what we require to just be intelligent. Do you know what I mean? In fact, people with ADHD may demonstrate intelligence across a lot of domains because they have such varied interests. They may want to read about a lot, perform in a lot of things. They may be great musicians, great with maths, great with language, but equally you would see that in none of these exams are they doing as well as some of their peers. So coming back to the story with this girl, when we went to her childhood, it seemed very likely that she had ADHD as a child. Now, you have to understand that we live in a world where a lot of children get diagnosed with ADHD. Sadly, a lot of children get put on medications for ADHD, which is a topic for a separate video altogether. But in this particular video, I wanted to stick to this particular topic of what I wanted to talk about, which is that how the um, underdiagnosis of the bedrock of our mental health can actually have very many serious ramifications of our life. So it is possible with some people who have ADHD that they grow out of it. In fact, that happens to most individuals, that once they hit puberty and further adulthood, it's likely that gradually they lose out on all the attributes of being ADHD and grow out of it. But some of them retain it through their adulthood. Having said that, the morphology of what it looks like in adulthood is very different. So in childhood, it may have very manifest, very overt hyperactivity signals, but as the person goes into adulthood, it's likely that they lose the hyperactivity side although they may still be very fidgety, very restless, very moving about kind of people who need regular physical activity, people who need a lot of walking about, trotting about, moving about, people who need a lot of mental stimulation, to talk to a lot of people, to read different kinds of books, to be exposed to different kind of experiences, to be doing a course, but also need regularly to be part of music festivals, also need to have a very active social life. So, some hyperactivity symptoms and signs may disappear during adulthood or may manifest very differently. But the inattention bit, and again, understand that inattention is not a uniform symptom. It's not like they are going to be inattentive for everything. But for an ADHD mind, it's very difficult to hold down their attention and focus to any and everything. It is a very selective kind of a brain where if they train themselves, they're able to hold their focus and attention to certain tasks, but in certain others they're not able to. So I didn't think that this girl didn't have ADHD. However, we have to understand that only someone who has had signs of ADHD in their childhood are likely to have persistence of that in the adulthood. ADHD is not something that will suddenly appear during adulthood. That's just impossible. So we are either born with it or we are not born with it. So this girl did have signs of ADHD, and what happened that as adulthood struck, the manifestation and the morphology of it changed and toned down. So whilst she was never as disruptive a child, that her ADHD got picked up through school, and anyway, ADHD can manifest a little differently in different genders. And I'm going to talk about this in my future videos, how there's a lot of gender difference in how ADHD and autism manifest in two different genders. And I know that there are more than two genders as it stands today. And like I said, as a psychiatrist and a mental health professional, I'm going to be talking about all of these topics, but that's for a later video. Coming back to this point, it did seem very convincing, and especially after taking history from her mom as well, that this girl did have signs of ADHD through her childhood. They were never disruptive enough, never severe enough to demand any attention. And through adulthood, whilst there was decrease in these symptoms, and whilst through adulthood the change in the morphology was very apparent, what happens is that as we grow into adults, the demands of life and demands of society are very different from us. We are required to submit assignments far more intensely, far more intensively. We are required to hold down a job. We are required to become better adults in terms of how we execute our daily life. We are required to have a better control of our grooming and our presentation to the world. The dating life opens up, which opens up a whole new box of Pandora, where there's so much performance to be made and so much to be delivered. Suffice it is to say that as we enter adulthood, the demands just get intensified from how we are supposed to put ourselves out there in terms of academics, in terms of profession, in terms of dating life, in terms of as being a respectable member of society, in terms of how we look, in terms of how we think, in terms of how we contribute, in terms of how we work, in terms of what our work ethic is, in terms of who we are as a person and what our identity is. And subconsciously and consciously, this is huge burden for any brain, let alone a brain with ADHD or autism, because it, like I said, is a neurodiverse brain which happens to fall in minority in the world. And the majority conventions of the world are decided by the majority brains, which are not ADHD or autistic brains. So often these individuals can get misperceived as defiant, offensive, uninterested, condescending, because they don't seem interested in the class. They seem to be fidgeting about. They are sometimes brighter than the rest of the lot, but equally seem uninterested. So they may give the impression that they are trying to act smart or be condescending towards others, or outsmart the teacher. These are often the feedbacks that a lot of people who have had ADHD would have gotten through their lives. Or they may find it very difficult to be regular with classes simply because their brain gets bored very easily, or their capacity for reception is far less, but their capacity for retention when they are reading on their own is far more. So with this girl, there was no doubt in my mind that she has been carrying these traits of attention deficit hyperactivity disorder. Now, those with ADHD, for some inexplicable reason, which I haven't been able to find the reasons for despite my long career, I'm sure if I were to look up for it, there'll be research out there. But for some reason, they have spurts of activity. In that, there'll be spurts of activity where they can hyper focus, hyper deliver, be hyper impressive in a certain task that they're really fond of. So if they're into poetry or sports or creative writing, or it's maths or language that they really love, they may hyper deliver in that particular aspect and hyper focus sometimes for 48 hours, for 5 days, for 7 days, for 10 days for a project, and be hyper impressive to most individuals around them. But then they have to have a corresponding phase which is inexplicable. There is not much maths or science to it as to why and when would they reach their phase, but they may absolutely crash, withdraw, lose all interest, and want to be on their own, and seemingly appear rather chaotic and disruptive, that a person who was delivering projects at the maximum creative levels with maximum delivery of speed and just ability to impress the most in the whole lot, suddenly is now not being able to deliver the bare minimum tasks as well in the class or in the profession, or even in their house life, how they keep their house, how they cook their meals, how they do their grooming, all of those. And I'm an example of that. So sometimes executive function is in my daily task can be so much of an issue that if today I had decided that, I need to keep my creative spurt, that I wanted to record this video aside and wanted to put proper makeup on and proper dress on, do my hair properly, I can guarantee that that video would have never gotten recorded. And which is why over the years, on occasions, I've trained myself to just be. The world that we live in, where the conventions are decided by the majority non-neurodiverse brains, sadly, we lay a lot of emphasis on how we present ourselves, what our presentation is, what kind of clothes we are wearing, what our first impression is. And as a psychiatrist for over 15 years, as somebody with autism and ADHD, and as someone who has done fairly well academically and as a professional, and having interacted with a lot of people who've done similarly, I can safely make this not so popular claim that we as a society need to lay far less emphasis on presentation, or the fact that my upper garment is carrying so many stains. Well, I'm a woman who lives on her own, who has an active professional life. She has to live in a country where she has to do all her chores herself, and is also trying to make these videos. So we've got to be accepting of a person in what their clothes are like, or what their hair are like, or what they look like, and be more interested in what they have to say. Sadly, there is a world in the past where we used to focus a lot on the wisdom of a person, the experience of a person, or the content of the person, or what density was lying in what a person had to say. But gradually, we've become a society, we are so deeply invested and enchanted in the external cover. And there'll be many out there who are going to judge me for that, and that's totally fine. But I'm a living example as a psychiatrist who struggled with autism and ADHD side of things, both of them. And trust me, it's quite difficult to pull off a full-fledged career with those. Having said that, it comes with its own advantages, especially in terms of my career, which I'm going to delve into future videos. But coming into the example of this girl, there was no doubt in my mind that she was going through ADHD. She's always had ADHD, but adulthood had intensified the demands on her ADHD brain. And what that had led to was that she was feeling incredibly burdened, and her brain was incredibly confused, because as a child, if she was creative and delivering academically, everybody else is happy. But as an adult, like I said, you have to deliver in very many domains, in domains of friendship, domains of self-care and grooming, domains of being a responsible member of society, domains of carrying out your daily routine well and looking after your meals and finances, and also delivering yourself as a great performer career-wise, academically, professionally, in terms of how you hang out with your colleagues and what people expect from you. So, since that demand gets intensified, the ADHD brain may feel overloaded and may not be able to prioritize, and may have a system failure, so to speak, that there may be days where they hyperfocus and deliver immensely well in certain projects, and then there are days where they're just not able to deliver anything because for some inexplicable reasons the brain is absolutely crashed and tired. And which is why, because of this spurts in performance and spurts in brain's ability, people go through a consequent change in their mood states, which sometimes even they don't realize that the mood changes are consequent to that. You know, They may on days be very creative, very sociable, and just out there and adventurous. But the downside of it all, when it manifests and takes over, it may be that they may become absolutely asocial, may seem depressed, may not want to interact with anybody. And the adventurous side of things may manifest as a more impulsive side of things. And when this persists for a certain amount of time, this obviously causes a toll on their self esteem and how they view the world, because they don't quite understand that their brain is designed in a manner to make them feel like they do, that their brain uh, confers them with a lot of advantages, but also equally gives them a lot of disadvantages. It is something that's not easily discernible by an individual who's in the middle of it, especially because they are not mental health professionals. So they start harshly judging themselves and criticizing themselves too. That why is it that I delivered that project just so well, but now I'm not being able to do my basic stuff either. So, this example amplifies the importance of understanding the basic bedrock, the basic platform on which our mental health is built. And carrying ADHD in your brain or carrying autism in your brain is sort of that bedrock which can then amplify your mood states, which can amplify the negative mood states, and which can make it seem like you're going through these mood fluctuations and all sorts of fluctuations. But actually, they are not primary mood fluctuations, they're all consequent to how your brain works, which is why the brain profiling of an individual is very important. And hence my point in this video, that whenever you visit a mental health professional or a psychiatrist, be sure that they delve into your childhood history and developmental history, because unless we delve into those side of things, we'll never be able to discern where this individual is coming from, what their journey has been like, and what their brain could be like, and what their brain performs like, what are the assets of this kind of a brain, what are the deficiencies of this kind of a brain, and what kind of an environment is this brain likely to thrive in, and what kind of a brain is this brain likely, what kind of an environment this brain is likely to suffer a lot more failures, lot more disappointments, and lot more criticism in. So yeah, in this video, I really wanted to highlight the importance of diagnosing the bedrock of mental health problems, where they emanate from, rather than misdiagnosing them as bipolarity or a personality disorder. I hope you got some useful insights from this video. Stay tuned for more such videos. Until then, please try to like, share, and subscribe for these videos to any of your friends or family members who may have struggled with this sort of a problem and sadly have never been diagnosed for the same. You'll be doing them good and you'll be doing me some good. Thank you for being with me in this video. Until next time, goodbye for now.